Good morning, dear friends. Welcome to this webinar where I'll be talking about refractive surgery. So this is specifically for those people who are thinking about refractive surgery and still have lingering doubts in their mind. So what I'm going to try over the next half an hour is to try and answer all your questions regarding refractive surgery, to make this presentation as interactive as possible and to work on from there. Now, what exactly is a refractive error? What happens is that when a person is looking at a distance object, the light needs to come onto a focus, onto the retina. So, if the curvature of the cornea or the overall length of the eyeball or certain other factors do not allow this light to be brought onto a focus, what we use is corrective spectacles or corrective glasses. So what these glasses do, that they interfere in the refraction that the eye is doing. So either they increase or they decrease the quantum of refraction, so that we are able to bring onto a focus the light which needs to be focused onto the retina. Now let us look at the whole thing that I am talking about. If this is the cornea that you have, onto the cornea the light is coming, it goes through an aperture which is called as the pupil, and the cornea brings the light, it condenses the light, and then there is a lens on the eye which further condenses it and brings on to a focus at the retina. Now the iris controls the quantum of light that goes through the pupil, and the clear lens then finally focuses the light onto the retina. Now these light signals or electrical impulses are then conducted onto through the optic nerve, which is right here, and goes onto the brain, where the brain perceives the picture. So this is how the eye processes vision. So it is akin to a camera. Like the light is coming, there is a lens which has a focal length. By changing the focal length, you are able to bring on to focus. In the olden days you had the film, so it is supposed to come onto a focus onto the photographic film, and then you develop and print that image, and then you can see it. Now if, as I told you, the vision is improper, that means the person has a refractive error, the light is not focusing onto the retina. Now what are the various types of vision problems? The most common vision problem that you have in young people is called as myopia. Myopia means nearsightedness. That means a person is able to see well for near objects, but a person has blurry vision for distance. So what it exactly means is that the light rays are converging more, and these light rays, as you can see, are coming to a point focus ahead of the retina. So there is this gap between the place where the light is being focused and the place where it needed to be focused. So what does one do? One makes a person wear glasses which are of negative power. That means you have negative number, or what you have is myopia. So this is the most common type of refractive error which young people have, which is called as myopia. Now look at a scenario which is reverse of myopia, where the power of the eye is less than is desired. Therefore the light beams that are to converge after going through the cornea and the lens, they come to a focus which is behind the retina. So the light is requiring a little more focal power onto the eye, and what you have to therefore do is that with this, the person is supposed to wear plus power glasses. With this plus power glasses, you add another lens, and therefore the light focuses, which is, instead of behind the retina, now it comes to focus onto the retina. This is also called as farsightedness, and the person needs these glasses more for reading but also for distance. Now adding to this myopia and hyperopia, where the eye is considered to be having a refractive error which is the same in this axis and this axis. That means the eye, the vision that the eye comes is like a football. That means it is round, and there is no difference. Wherever you see the football, the radius of curvature is the same. But if you imagine, instead of a football, it being a rugby ball, that means it is an elliptical or an oval ball. So what is the difference here is that the radius of curvature in this axis is different from the radius of curvature in this axis. So what would one do in that case? In that particular case, instead of a minus power or a plus power, the person would require to wear a cylindrical power. That means a power with an axis. So the glass prescription would therefore require a spherical correction plus a cylindrical correction. So this defect in vision is known as astigmatism, meaning that the power in one axis is different from the other axis. Astigmatism is usually combined with myopia or hyperopia, and the eye could be so complex where one axis needs a plus power and the other axis needs a minus power. Now there is a fourth type of refractive error, and this fourth type of refractive error is called as presbyopia. Now what happens is that when you are young, this crystalline lens that we talked about, the lens that is there in the middle of the eye, this lens has the capacity to contract and expand. That means that it can make itself more dense or less dense and therefore change its refractive power. So this is known as accommodation. So the patient is able to simultaneously see. If a person wants to see near, the power tends to increase. If a person needs to see for distance, the power tends to decrease. Now as you age, the muscles of the lens lose the flexibility, as also there are certain changes in the lens which does not allow it to change its curvature that easily. Now this is therefore called as presbyopia or a disease of aging, where normally people above 40-45 years of age would require to wear separate glasses for near and distance. Now this is something that is almost inevitable for everybody who is aging, to be requiring glasses which are separate for reading. Now let us discuss, after having discussed as to what are the refractive errors, myopia, hyperopia, astigmatism and presbyopia, as to what are the options to correct that. There are several people and several trials that are going on to try and reverse myopia, to try and reduce hyperopia, but to suffice to say as a bottom line statement that as science stands today, there is no specific treatment by which you can alter the curvature of the eye or the cornea by just putting drops, etc. So there has to be options, and these options are broadly divided into two. One is a non-surgical option and the second is a surgical option. So non-surgical option is that a person is either to wear the proper power of spectacles, or if a person does not want to wear spectacles or try and get better vision, the person can wear contact lenses. Now after the non-surgical, if a person wants a permanent cure for the refractive error, then the person would have to go in for surgical options. So before surgery, this is what a person requires, either glasses or contact lenses, or when you do surgery, the commonest performed surgery nowadays is either the SMILE procedure or the earlier version of SMILE, which was called as LASIK. So these procedures are giving you better quality of vision, they give you functional independence, the field of vision increases, the lifestyle of a person changes, a person does not need to be hassled with glasses or contact lenses, a person can pursue any occupation. You can become a commercial pilot, you could do scuba diving, you could become a part of the merchant navy, you could become a Jawan in the army, because these kind of professions do not allow a person wearing glasses, or even if a person is wearing glasses, they have a limit on the power of the glasses, because this is the occupation where a person needs to have good unaided vision. And this also saves time, energy and money as compared to a lifetime hassle of glasses and contact lenses. So friends, therefore what we are talking about is surgical option to permanently correct the power of the cornea or to alter it so that a person does not need glasses or contact lenses anymore. So, this is for you a liberating decision, but it has been found that people take more than a year to make this decision. Now, if you look at laser vision correction has been around from the mid 90s. So, that means it has a track record of more than 25 years. And if you look at any of the procedures which are done to correct deficiencies within an individual, this is the most commonly performed elective procedure. And when people were asked whether they took a right decision or not after having got the procedure done, the satisfaction rate is among one of the highest among any procedures, with more than 95% of the patients having said that they were hugely satisfied with this procedure. Now, if you are thinking about getting laser vision correction, I am going to answer a couple of questions. The first question that comes, are you a candidate for getting the SMILE procedure done, which is the latest and the most advanced version of laser vision correction? And what are the criteria for getting a SMILE/a LASIK procedure done? Now, the first question that you have to ask yourself, are you 18 years or above of age? If you are, make a tick. Second, do you wear spectacles or contact lenses? Again, yes, then you make a tick. Then the next question is, have you had a stable eye power for at least the last 6 months to 1 year? If yes, tick it. In case your power is still changing, it is advisable that you wait till such time that your power becomes normal or it becomes stable. And finally, the question that you need to ask is, for a better functional quality of vision, for being able to pursue a particular occupation, for being able to play sports unhindered, etc., would you want to get rid of spectacles? If the answer for all of these is yes, then you are a right candidate for getting the laser vision correction. So, you can take the test and find out now the answer for all these 4 questions and decide whether you are a right candidate or not. Now, if a patient comes to a doctor and says, well, I need to get a laser vision correction done, what would the doctor do? The doctor would require to run certain advanced tests, which would include looking at the corneal curvature, the topography, the thickness of the cornea, to look at the power and also to look at the retina. Before you come for a test, it is important that you have discontinued contact lenses for a few days prior to the workup. If you are wearing a semi-soft lens, it needs to be a minimum of 2 to 3 weeks of discontinuation. Now, LASIK, which is the most commonly understood word, stands for laser assisted in situ keratomileusis. So, what it means, you are using a laser. In situ means within, kerato means cornea, mileusis means reshaping. So, you are using the laser within the cornea to reshape the cornea with a laser beam, and this corrects the vision of an individual by permanently altering the refractive power of the eye, and it can treat from low to high refractive errors, both in the minus power, both for the plus and the cylindrical power. Now, what you do is that you collect the data. The doctor or the ophthalmologist along with the technical team of optometrists would collect this data, and this data is called as a wave scan. And this is an individualized surgery. You collect these data after seeing that the patient is suitable for getting the procedure done. This also recognizes the iris by using NASA space technology, and this information that is gathered before the surgery goes on to the laser. Now, the first step in a LASIK procedure is to create a flap in the front transparent window of the cornea of the eye, which is called as cornea. So, first step is you place a suction ring on the cornea, and then you have a motor which is having gears, and there it moves on to this plate, and this has a blade in itself. So, the motor goes over the cornea which has been sucked up, and it creates a flap with a hinge. So this is a flap that is created. It is akin to a door, like you open a door. So similarly, this is a flap that is created, and you can expose, therefore you expose the surface of the cornea. Now the next step is the data that you have collected on the wave scan is then entered onto the excimer laser, and these laser pulses hit the cornea, and like you can see here, they reshape the cornea. So certain amount of predetermined tissue is removed from the cornea, and then the flap is put back onto the cornea. So you can see that the flap is put back on the cornea, and this seals on its own. Now the flap can be created either what I showed you by a microkeratome or a blade, or there is a second laser which is called as a femtosecond laser. The first laser that I showed is known as an excimer laser, which is a burning laser, but now we have since the very early 2000 a femtosecond laser which actually cleaves the cornea to create this plane and to create the flap. This is much more sophisticated. You can get thinner and finer flaps, and the chances of something going wrong while making a flap are significantly reduced. So this is known as a bladeless laser, LASIK laser, bladeless LASIK laser. Microkeratome is this is the first type, which is the blade LASIK, and this is the bladeless or the femtosecond assisted laser. Now this is the femtosecond laser. As you can see, this is a wavelength of around 1064, which is a glass laser, and now we are having the fiber laser also, and you can make flaps which are much better. So you can see that these are planar flaps which sit much better on the cornea after they are deposited as compared to blade keratome. Now once this laser excimer has been done and the flap is put back, you get almost reasonable good vision within the next few hours or the next day. Now the latest in laser vision correction is that instead of using two lasers, if we use one laser, and this is the femtosecond laser, we can use the laser to reshape the cornea by creating a flap in the cornea sorry, by not creating a flap in the cornea, but creating a lenticule below the flap, and you can remove this lenticule through a 2 mm incision. This is FDA approved now, and it is a flapless, bladeless procedure. It is all laser, it is painless, and the recovery is very good. So here we are not creating a flap, and therefore if the incision is small, the biomechanical strength of the cornea is better preserved after the procedure. Let us just see an animation as to what exactly is this procedure. Audio आ रहा है? So this is the smile suit. And when we were looking at previous refractive surgery, you would make a 20 to a 22 mm side cut. So now a 2 mm side cut, as you can see here, which is 90% less side cut than what was there before. And this is the feature of refractive surgery, which is called as refractive lenticule exchange or small incision lenticule extraction, which is all femtos, single step, and this is how it is done. Base of lenticule, top of lenticule, base is the power, that is the thickness is decided. Side cut. This 2 mm is what you need to access the lenticule, and you pull out like you are pulling out a letter through an envelope. You pull out the lenticule, and that is the end of the procedure. So there are less nerves that are cut, so the patient has less dry eyes. And you can see again an animation. So only nerves cut at the side cut as compared to nerves having been cut all around in the basic preservation of biomechanical stability and a single step procedure for this fantastic laser vision correction module. So let us actually now see the procedure being done live. So there is a green blinking light that the patient sees. We press on the foot switch of the laser and we create the posterior lenticule. That means that this is the lower part of the lenticule that has been created. There was a side cut 360 degrees, and now the upper part of the lenticule, which is known as a cap, has been created, and you saw that there was a 2 millimeter incision that we created. So here you can see we go in from the 2 millimeter incision, and with this fine spatula we go above the lenticule that has been created by the laser, and now we go below the lenticule which has been created by the laser. Now using a blunt rod like spatula, we then again go into the top of the lenticule and separate the cap. Mind you, this is a cap, not a flap. So we separate the cap from the underlying lenticule, and now we go ahead with the same blunt rod below the lenticule. So you can see this is the second plane of dissection that we have created, and we are going below the lenticule, and we are now disengaging the lenticule from its side. So this was the lenticule, which is usually about 6.2 to 6.5 millimeter, which is the refracting lenticule covering the entire pupil, and now you can see that's the thin, very thin microscopic piece of the corneal tissue that we are so elegantly bringing out of a 2 millimeter incision. So that's the lenticule which in the LASIK procedure would have had to be burnt by the laser. In this case, a lenticule is created and we take it out and look at the pristine cornea that we have. So friends, this is the latest that has taken the world by storm, which is the SMILE procedure, which is the laser vision correction that you have. Now post-operatively, the patient has fantastic vision within the next 1 to 2 days. However, full vision stabilization may take 1 to 4 weeks. More the power of the patient, more would be the time for visual recovery. There are no bandage that are required. Eye drops are instilled for 4 weeks. You should avoid direct contact with water and rubbing of eyes for 1 week, and you need only to possibly take a day or two off from your normal work, and you can get back to work. In the SMILE procedure, there is no restriction of any sort as regards playing football, rugby, contact sports after the procedure. Now, to sum up, I would say small incision lenticule extraction gives you precise results, it gives you more stable outcomes, it causes less dry eye, it is biomechanically causing a stronger cornea. That means that the strength is less compromised as compared to LASIK. And since there is no flap, there is no flap related complications, and there are no restrictions on contact sports or doing anything active after the procedure. Now, as I told you, there are certain situations which we have to look at, and that is if you are having a thin cornea and you are not suitable for SMILE or LASIK, what do? There is something called as surface ablation, where instead of creating either a cap or a flap, you just remove the epithelium and do the excimer laser straight off. And you can also use mitomycin C as an immunomodulator so that there is no haze or regression in this particular case. But if you have a very thin cornea, or your power is above -10, -12, then instead of working on the cornea, what we do is known as an implantable Collamer lens. So implantable contact lens or a Collamer lens is a lens which is implanted within the eye. So you can see this, there is a lens that we inject within the eye. So it is like a contact lens, rather than being worn on the cornea, is being pushed behind the cornea so that the person does not need refractive correction. Now, the next question that people ask is, can I still get laser vision correction at 40 or above? Now, as I told you that if you have aged and you are 40 plus, you would have developed presbyopia, which means that you would require glasses which are separate for distance and near. Now, there is a new technology that has come in which is called as press beyond or laser blended vision. the results are pretty good. In this, what we do onto the cornea is that we do customized treatment. We do a type of a monovision where one eye is corrected for distance and one eye is corrected for near, and along with that we are also inducing a customized spherical aberration on both the corneas, so which can increase your depth of focus. So what this allows you is an excellent vision at all distances. It is a customized treatment, it gives quick recovery and it gives improved visual acuity. So people who are not very exacting in the requirement of their work profile are very happy with this press beyond laser vision, where you can correct both for near and distance, but understand there is some amount of monovision where one eye is dominant for distance and the other eye is dominant for near. Now, some questions before you put on the questions to me, I would answer on my own. The first question that everybody asks is refractive laser correction safe? So what it shows is that the safety of laser vision correction is even one-time surgery, the chances of something going wrong are less as a percentage as compared to a lifelong wearing of contact lenses. You can have allergies, you can have infections, etc. with contact lenses, which you will not have once your laser vision correction has been successfully done. So it is one of the safest procedures that you have in the present era, and the safety profile has increased further by the introduction of the SMILE procedure. The second question that people ask, is it permanent? Because if you have got the procedure done, would you require to keep on getting it done every third year, fifth year, etc.? So the answer is yes. More often than not, in more than 95% of the cases, the procedure is permanent. There could be undercorrections or overcorrections, which in today's era have come down. Higher the power, there could be some standard deviation where there could be a mild under or an overcorrection. Now this can be redone by testing the cornea again, and normally after 3 months of stability we can redo if there is an under or an overcorrection. Typically there can be some regression in a very small percentage of patients who were basically working a lot on computers, or women who get pregnant. They could have some hormonal changes which can cause a little bit of regression, or if you start going and living in very high altitudes where there could be a difference in the UV light, there could be some amount of regressions, but overall undercorrections and regressions are below 4 to 5% in the population that undergoes laser vision correction. Now the third question is, what procedure is right for me? How do I assess the various technologies that are available? Now this you have to leave the decision telling to the doctor or the ophthalmologist who would make you undergo rigorous tests for the cornea, etc. Once you have these tests, what you are wanting to do is to check whether the procedure which procedure can happen. So what I typically say is, it is not that I will fit one procedure on all types of eyes. You would have to customize the type of procedure that eye would require. Whether if a person has a very high power, we may go in for an implantable lens. If a person has a plus power, a hypermetropia, we would go in for a blade-free LASIK. But if a person has a standard myopia up to -10 with an astigmatism up to -5, I would prefer the best procedure that would suit your eye if you have adequate corneal thickness is SMILE. So finally, I would again wish to say, one size doesn't fit all. We would see what procedure fits well on your eye and would advise. So it is better to go to a place which can offer you the entire gamut of refractive procedures, so that the best procedure is chosen for you, so that you get the best outcomes that are there. Now what is very important is that you need to go to people who can be trusted, those who have adequate experience, because though rare, but you can have issues during the procedure or after the procedure which need to be adequately handled. So what you have to do is to choose diligently based on patient referrals, patient inputs, based on how much surgery an individual has done, whether a person is cornea trained or not, and therefore you need to look at the experts and trust the experts, and it is better to go to places where you can have a treatment, worst case if you have any complications that needs to be treated. So this is all that I would wish to say. If you have any further queries for us at Center for Sight, you can reach us at 95600 95600 and an alternate number of Center for Sight is 9015602000. I'll repeat again, 9015602000. And that is the brief overview that I wanted to give you for vision correction, for refractive surgery, and the common questions that you would have. So friends, I would now wish to open up for any questions that you may have. Thank you. So the question is by Shankshipta Kavar, and she is asking, is there any side effect of LASIK operation on the cornea? Well, to answer the question, it is a precise procedure where only limited amount of corneal tissue is taken away. Yes, the thickness of the cornea comes down, but there is no other significant adverse effect on the other layers of the cornea. That means that the inner layers of the cornea, the endothelium, which is the most critical layer of the cornea, does not have any side effect. The nerves of the cornea are cut to a small extent with the SMILE procedure and to a larger extent in the LASIK procedure, and you could feel some amount of dryness. So we obviously always give lubricant eye drops to the patient, which continues for at least 6 to 8 weeks. The next question that has come in is from Mr. Shad Ali, and the question is, how long will vision correction last? Well, Shadji, I have already explained to you that you would have this vision correction which would last possibly through your lifetime. And the second question that you have is, will I need reading glasses after my refractive surgery? Yes, the answer is when you become old. I'm sure you are young, so if you cross 40, 45, you would be requiring to wear glasses for reading, which would be separate from the distance vision. So if you would have not got your laser vision correction, you would then have to require to wear a a progressive glass where the power would have been different for distance and for near. But in your case, if you get a refractive procedure done, you would only be requiring to wear glasses for reading once you achieve the age of 40 plus. The next question comes in from Mr. Rahul Mishra, who says, how many day rest I need after surgery? Well, if you're going in for the flapless, bladeless procedure, which is the SMILE, I would say the rest is limited to maybe less than a day, and you can resume your normal activities except maybe swimming. In women, I would say applying kajal, mascara and direct splashing of water, you should avoid that for about 2-3 weeks. Otherwise, you can resume all your normal activities within a day or two. The next question has come in from Paramjit Kumawat, and the question is, how soon after the surgery will I be able to see? Well, the moment you get out of the bed, the laser vision correction bed, you do start to see. But by the next day or within few hours, 6 to 8 hours or next day, you have a recovery of almost 90 to 95% of your vision, and then it just modulates very slowly over the next 3-4 weeks, and the full vision stabilization, depending on your power, could take anywhere from 3 to 6 weeks. The next question that comes in is Gordhan Kumawat, and the question is, will I need reading glasses after LASIK surgery? Well, I have just replied, if you are young, up to the age of 40-45, you don't need reading glasses, but after that you would possibly require reading glasses. Otherwise, you can go in for the press beyond correction and even take care of the reading glasses. The next question comes in from Sunny Singh. Is the procedure painful? Well, I'm sorry I didn't say that, but we numb the eye with anesthetic eye drops, and there is usually absolutely no pain while the procedure is being done. After the procedure has been completed, For 4 to 6, 8 hours you may have a little bit of discomfort or like what you say foreign body sensation, जैसे आँख रड़क रही है, that you have for few hours, but apart from that usually there is no pain into the patient. The next question comes in from Varsha Arora. Question: I have heard that LASIK causes night vision problems. Is this true? Well, what you have heard is to some extent correct. Yes, there can be glare and scatter, but that is usually in people who have very large pupils or people who have a very high power. Usually these glare and halos settle down over the next few weeks. Now why this happens is because the cornea, which is steep in the center, is made flat to correct myopia, and the light which is going through the center of the pupil and the periphery of the pupil do not come to the same focus point. And because you have these separate focuses, there could be like a halo or a slight glare around the image, and that happens typically if you are in very dark conditions. This is a reversible problem. It lasts for a couple of weeks because you have got a new thing done, so you kind of feel it, but the brain has enough plasticity to adjust to this, and normally these problems do not pose a significant problem. Okay, the next question that is there is by Jyotsna Goswami. How much this glass removing procedure would cost me? Okay, what is the minimum cost? So the costs depend on the type of equipment that is being used by the or by the individual who is doing this procedure, and it could vary anywhere from 25,000 to 1,30,000. Smile is by far the best procedure that is available. The machine is very expensive, the consumables are very expensive, so that costs a little bit more, but the range I would say broadly would be anywhere from 25,000 to more than 1 lakh, 1,30,000, 1,50,000. That's where it can go to. Question comes from Kuldeep Kumar. Sir, I have cylindrical number of 2.5. Is it possible to correct this? The answer, if you are suitable from the corneal parameters, yes, it is absolutely possible to correct a pure cylinder of minus 2.5. Jitendra Kumar asked, will I feel anything during my LASIK procedure? The answer is no, you will not feel anything during the LASIK procedure. You are fully awake and there is no pain. Ankur Nama says, how often will I have to see the doctor following my surgery? The typical post-operative regimen that we follow at Center for Sight is that you need to see the doctor day 1 after surgery, 1 week and 1 month. So these are the 3 visits that you want to do. You could follow up at your local ophthalmologist if you are not from where Center for Sight is available, but these are the normal visits that you have. The next question comes from Ayushi, and she is asking, I only wear glasses for reading, can I still have LASIK surgery done? Well, I just told you that you can, if you are above 40-45, you can undergo the press beyond vision correction, and that you need to be evaluated. We first do the test to see whether a press beyond monovision kind of a therapy suits you or not, and we can actually go ahead and do that. The next question comes in from Riya Kaushik, who says, what are the risks of LASIK surgery? Well, risks of LASIK surgery have been clumped together. So possibility of a complication that can impact your vision. That means today if you are seeing 6/6 or 20/20, and because of any complication which could be related to the cornea, which could be infection, which could be visual complaints, etc. So anything which can impact your vision, falling from 6/6 to 6/12, that means from 20/20 you are down to 20/40, the percentage of that or the possibility of that is less than 0.001 to 0.002. That means only 1 to 2 per 10,000 eyes in good centers where people have experience could have some vision deteriorating complications. This is all the complications lumped together. The thing which we don't count as a complication is mild undercorrection, overcorrection, or a situation where there is a regression. That possibility, depending on the power, could be anywhere between 2 to 5%. But what we have observed and other doctors have observed, that once one is switched over to SMILE, the chances of the result having a standard deviation go down still further. Well, Ranjit Geeta Prasad asks, are the results achieved from LASIK permanent? Yes, as I told you, more often than not, in 95 to 97, 98% of the cases, there is no regression and they are permanent, the results. The next question comes in from Devinder Rawat, who asks, sir, are dry eye symptoms better after LASIK? No. Dry eye can become a little worse. So after laser vision correction, LASIK causes more dry eye forming. So if you have some dry eye situation before, get treated, get the dry eye better, and then go in for a smile procedure, because the dry eye is much less in the smile procedure. Saurabh Sharma is asking, hello sir, is LASIK eye surgery covered by insurance? Well, there is a consumer court judgment which says LASIK is a functional surgery, it should be covered. But usually the insurance people do not cover, but some insurances, which are corporate insurances, cover laser if it is more than -6 diopters. So you will have to check out with your insurance people and see what are the exclusions. But typically it may not be covered. Neha Sharma, do I need follow-up care? Usually you would require to see your ophthalmologist not more than once in 6 to 12 months after the laser vision correction has settled down. Lavina Chandani says, how accurate is LASIK? Well, if I have to give an answer within science or within medical, everything that we are doing is increasing the accuracy, and typically I would say it is one of the most accurate procedures that have been seen. It is much more accurate than, say, a cataract surgery, etc., and a high degree of accuracy is expected out of LASIK, but some under overcorrections can happen. Amit Royal says, doctor, what percentage of patients attain 20/20 vision or better without glasses or contact lenses? Well, the question, if you are, depends on the procedure that is being done, but typically 20/20 vision is got in a very high percentage of cases, and almost more than 99% of the patients would get more than 20/30 and 20/40 vision. So you would be possibly having 20/20 vision, and at times you can even get better than 20/20 vision. Sunny Singh asks, is it possible to join force after refractive surgery? Yes, you will have to see. You can join as a commercial pilot, you can join even as a transport aviation, but I don't think fighter pilots in India are still allowed. However, in the US, NASA has allowed laser vision correction. Jawans are allowed to have had LASIK, but there are certain criteria that you just need to check up, that the LASIK must have been done at least 6 months before, must have been stable, and the corneal thickness should be at a particular level. Vijay Lamba, sir, which is the more safer procedure to get rid of glasses? Well, in my belief and in belief of several surgeons, I think the best procedure that is available today is a smile, and there are scientific reasons to say that improved biomechanical strength, like better biomechanical strength as compared to LASIK, less dry eye, more stable results, etc., and being flapless, so no flap related complications. Again, I think Amit Royal has come in. Doctor, what percentage of patients? I just answered that attain 20/20 vision or better without glasses, so I have already answered. We have Pushpak Kacholia. What are the differences between traditional LASIK and custom LASIK? Well, traditional LASIK, the reshaping of the cornea was done basis only your refractive error. That means whatever was the power of the glass is just put onto the machine, the sphere and the cylinder, and then the correction is done. In custom LASIK, you use a very sophisticated equipment which is called as wavefront analyzer. Now this measures, or it is also called as an aberrometer, this measures the entire aberration profile of the eye. That means apart from the sphere and cylinder, the lower order aberrations are also measured along with the higher order aberrations, and then a customized treatment is made. So if I am buying a coat or a suit, I can go and maybe buy, say, a shirt at 40 which would fit me, but if I go to a tailor, the tailor is going to actually make the shirt as per my, say, shoulder. One shoulder could be higher than the other, or you could have the length of your of your arm being slightly different, etc. So this is customized laser is fitting or tailor-made procedure rather than just on your power. Sonovar Jamil Khan asks me, how soon after LASIK surgery can I resume normal activities? Well, Sanovar, the answer for you is within 1 to 2 days you can resume your normal activities, though there are some restrictions. You will have to put the medicines for 6 weeks, but there are some restrictions like don't swim, don't put collagen mascara, and you would also be required to not do rigorous contact sports, etc. In LASIK, but in SMILE maybe you can even do that. Sudhir Kumar, do I have health condition that might rule out this procedure? Yes, very good question, Sudhir. I think that's something that I missed out. People who have collagen vascular disease, people who have rheumatoid arthritis, people who have problems that can be immunosuppressant, etc., those people should not undergo the laser vision correction because there can be side effects of dry eye or corneal melting in these cases. Shobha Bish Saxena, no, what's the question? Just go down. Pavan Sani is asking, if I wear contact lenses, should I take them out for a certain period before surgery? Yes, if you are wearing a soft contact lens, at least 3 to 7 days before surgery, semi-soft 2 to 3 weeks before surgery. Why? Because this can have an impact on the corneal parameters that we are assessing. So if you are off contact lenses, you would be better, the data that we collect for treatment would be better. Shobha Bish Saxena, I only wear glasses for reading. Can I still have LASIK surgery? Yes, the answer is you can still have LASIK surgery, and that would be in the form of press beyond, but we have to see whether you are suitable for a press beyond or not. So this is Z Tria, and hello dear sir, my name is Michelle. I have already done LASIK vision correction 1 year back, but I still have lots of dryness in my eyes which fluctuates my vision, thereby making my vision very unstable. Is there a way to heal this dryness? Well, you will have to come for an eye exam, and we'll have to check as to your tear film, your meibomian gland dysfunction, whether whether it is an aqueous or a lipid profile deficiency. There are several ways to treat dry eye, but you will need to come for an assessment. You can also use punctal plugs, you can use cyclosporin eye drops, chloroquine eye drops, but obviously the doctor will see and would advise you. There is a possibility that your dry eye can be taken care of by us. The question again is it risky to play contact sports after LASIK laser surgery? After SMILE, there is no difficulty, but if you have got a flap laser, yes, if there is a direct blow onto your cornea, reports have been there where the flap can get dislocated. So better to avoid a direct hit onto your eye. Arjun Sani, who can undergo this LASIK vision correction? As I already told you, above the age of 18 to 20 years, have a corneal thickness which is adequate, topography which is good, and a stable power which is there, and you don't have any retinal problems. Next question. These are the questions that we have had, and I have tried to answer them to the best of my ability. But friends, to sum up, I would just wish to say that there are several people who are skeptics about laser vision correction, but just to re-emphasize that if you look at groups of patient population, the patient population as a percentage who have got the maximum number of laser vision corrections treated are ophthalmologists themselves. So it is not that the ophthalmic community does not have faith. The ophthalmic community has a lot of faith in this procedure, that they are willing to do it or getting it done on their own eyes, as also getting it done for their near and dear ones. So if you want good functional vision, you want to get up in the morning without having to search for your glasses, you want to do scuba diving, if you are at a high altitude and suddenly you lose your glasses, what are you going to do? So you want to join certain occupations, you want to become a cadet, or you want to do railways, or you want to do army, etc. Well, we have a solution for you, and that is laser vision correction. And the laser vision correction has evolved significantly to the best as things stand today, which is the small incision lenticule extraction or SMILE procedure. Thank you very much for being with us, and if you have any more questions, you can email to us, or you can write to us, or you can phone in, and we shall be happy to answer your queries and take care of all your requirements that you would be wanting as regards laser vision correction. Have a great day. a Merry Christmas and a Happy New Year. Thank you.